All right, so Wayne. Hi everyone, Annabell here from BioHack Wellness Medical Clinic in San Diego, and I've got Wayne Adams here, and he in September had a hip surgery on his right side. Would you like to just share a little bit about your journey and like how you got into hip surgery as a amazing ice climber, athlete, and runner, and all of the things?
I ended up growing a little bit too much bone on the tip of my femur, and it was tearing the cartilage apart.
Okay.
So my surgeon shaved some of the bone off and fixed the labral tear and repaired as much cartilage as they could, but
Wow.
I'm still in the healing process.
Yeah. Oh, wow. So we're only January 9th. This was in September. When September?
September 22nd.
Okay, so not that long. And all we're going to do here, we're not going to overdo it. We're going to start at, I have it at 0.1, and I'm going to go super slow, and we're just going to work in the area that he has obviously had some scar tissue, but he has been already back to the gym for weeks, correct?
Mm-hmm.
And he's already able to do squats, whether that's both legs, one leg. Are you doing lunges?
Doing some lunges, yeah.
It's amazing. So he's lifting things. He's doing great. But what we would love to do, because one thing about StemWave that's amazing is post-surgery is just encourage more healing as quick as possible, because this guy's got to get back to the, like, he needs to start squatting in the squat rack a little bit more, I'm assuming.
Mm-hmm.
So we're gonna play that out a little bit more here with the StemWave. So how about this? I'm gonna go, I did 0.10 already. We mapped you. You felt you were at a 1 or a 2? Okay. So I'm only gonna go up 1 point. We're not gonna go crazy. We're at 0.11. This machine goes up to 2.5.
Okay.
So obviously we are micro, but this is a new injury. We're not trying to hurt it. We're trying to heal it. So I'm just encouraging additional, stimulation of stem cells to come to that area. So it's kind of loud. Don't mind us. We're going to be starting right now. 100 pulses. I'm going to start here, and as soon as we hit a spot that you feel is hitting a 2 at least, let me know.
Okay.
And he has 2 scars. He has a scar here and a scar here. But he was saying that the inner part, which, a lot of people don't realize that the hip is actually more towards the groin. That's actually where the hip is at. Most people think the hip's over here. That's actually not true. The hip is very close to the inner part of what we call our groin. So I'm going slow. How's this feeling?
That's really non-existent for the most part.
Okay. But you can feel the
I
pulsing.
can feel a snapping sensation. That's not painful though.
Okay. Good. We don't want pain. We want, but if it gets, so that was already 100. And that goes quick. I'm going to put you up another point. I'm actually going to go 2 points. Let's go point, But we can keep going. I don't want to hurt you, but I do want you to be like, whoa. And then I'd like to go down a point. Right at that spot, I think is a sweet spot.
Okay.
All right, so here we go. How does that feel?
I think you're getting close to the spot.
Okay.
Yeah, I'm starting to feel a little bit more there.
Right there. I feel a little, it could have been a muscle, but it also could have been a little bit of a knot.
Yeah, maybe back a little more to my left, or sorry, my right. Yeah, I can feel a little bit more right in that area.
Okay. And that would make sense because your scar is actually like perpendicular to that area, and I'm sure there was some sort of microscopic, what do they call that? Type of surgery where they're coming in with laparoscopic.
Laparoscopic, yeah.
So that whole tunnel is actually damaged until it heals back, which, your body is pretty impressive. He takes good care of himself, but that doesn't mean that he doesn't have scar tissue. So we have to remember that. So we're going to go up. I'm now at 0.14 for everyone's reference, and we're going to go another 100 here. Try to not waste these 100 pulses. I want to see what you think, and I don't want to hurt you, but I'm going to go back in the same area.
Right in there.
Okay.
That's where I start to feel it, yeah.
Okay, is it like, feel it like pain or feel it like wow?
Mostly like wow, I'd say that's like a 1.5 on the pain scale.
Oh, okay.
Yeah.
That's not bad.
Yeah.
But we don't want to hurt you. We don't want you to feel bad. But what we're going to do is just encourage healing, break up scar tissue, help it to just reduce inflammation. That's what we're looking for. Reducing inflammation. And I can feel like this is where the hip kind of comes around. And I'm just going to encourage here by your scar. Just for the scar tissue purposes. Is that okay if I come back through here? Okay.
Yeah.
I'm gonna go up one more. If this starts to hurt, please tell me. We're gonna go here. This is much closer to where you were feeling it before.
Yeah, it's a little bit different right in that area.
Yeah.
It's not, I wouldn't say painful, but there's a sensation there.
Okay.
Right there especially.
Okay. So I'm gonna keep moving it. I'm not gonna put too much energy in that spot, but I'm gonna do enough that it's going to encourage just a little breakup of scar tissue. So we're gonna go like this, and I'm gonna angle it so it's going back out towards your hip. So remember, this is a very trigger pointed. So I'm gonna push a little harder. I'm gonna come over here. There you go. So the thing about StemWave compared to like SoftWave and other machines is almost looks like a spark plug in there, but the way that it works is like a funnel. And so when the energy from the acoustic comes out, it's very targeted. Unlike a lot of our other machines that are like this, they've been using this overseas for many years. So when I turn it, I'm now taking it and pushing it outside of his hip, right? Moving it over to the side. So that is really important. Whenever you're using the StemWave, you shouldn't just go straight down. You should be moving at different angles because you want that wave to move all the way through the tissue. So we're gonna go one more time. We're gonna go up one. And again, if this hurts, I need you to tell me. So here we go. All right. And I'm in this same spot, I know. But I really do want to put enough in there that it really makes it worth it.
Yeah.
And then I'm going to do what I was talking about is we're going to angle this to come out towards his hip a little bit. And I'm going to come down. And I'm getting a lot closer to where one of that incisions were because you can see the scar. Just for breaking up scar tissue. And I can feel it. It kind of pushed me out, which means there's probably a little knot right there. So we're going to just work on that. And that's going to be good for you. Yeah.
Wonderful.
Yay! I'm so glad you did this. So this was his first treatment, and I suggest before he heads home, we're going to do one more.
Okay.
Awesome. So thank you so much for joining us. Thank you, Wayne, and we will give you an update later on Wayne.